Why does central sensitization cause CFS and ME pain? Imagine your nervous system as a finely tuned alarm system. In chronic fatigue syndrome and myalgic encephalomyelitis, this alarm system becomes overly sensitive, causing pain even when there's no real danger. Central sensitization is a process where the brain and spinal cord change in ways that make them respond more strongly to sensory signals, especially pain signals. This heightened response leads to the widespread and persistent pain many people with CFS or ME experience, even without tissue damage or injury. One way central sensitization causes pain is through increased sensitivity to stimuli. Normally, gentle touches or mild temperatures don't cause pain. But in central sensitization, these harmless sensations can become painful, a condition called allodynia. Additionally, stimuli that are usually painful, like a pinprick, can feel much more intense, which is known as hyperalgesia. This means that everyday sensations can become sources of discomfort, contributing to the ongoing pain that is common in CFS and ME. Persistent signals from the body, such as immune responses or minor injuries, can cause the nervous system to adapt in ways that make it more excitable. Over time, this neuroplastic change results in the neurons that process pain becoming more active and easier to trigger. At the same time, the brain's natural pain-inhibiting pathways become less effective. This imbalance means pain signals are amplified and pain thresholds are lowered, making even mild stimuli feel painful. Immune system dysfunction also plays a role. In CFS and ME, immune activation often leads to the releases of inflammatory substances called cytokines. These substances can sensitize nerves outside the brain and spinal cord and activate cells within the spinal cord that enhance pain signals. This immune response can set off or worsen central sensitization, creating a cycle of increased pain sensitivity. Studies show that people with CFS or ME often have a generalized increase in pain sensitivity. They may feel pain from pressure, heat, or chemicals more readily than healthy individuals. Exercise or physical stress can even make their pain worse, which is unusual because in healthy people, activity typically helps reduce pain sensitivity. This widespread sensitivity explains why pain in CFS and ME is often felt all over the body and not limited to specific areas. Because central sensitization involves changes in how the nervous system processes pain, the pain experienced in CFS and ME is often diffuse and not linked to any particular injury or inflammation. This explains why patients report pain that seems to lack a clear physical cause, yet is very real and distressing. Understanding this process is important for managing pain in CFS and ME. Treatments aim to calm the overactive nervous system and strengthen the body's natural pain control mechanisms. Approaches include medications that modulate nerve activity, as well as non-drug therapies like gentle exercise, cognitive behavioral therapy, and education about pain. These strategies focus on reducing the brain's tendency to amplify pain signals and improving overall quality of life. In summary, central sensitization causes CFS and ME pain by making the nervous system overly reactive to sensory inputs. It amplifies pain signals, lowers pain thresholds, and results in widespread discomfort. This process is influenced by immune system activity and neuroplastic changes in the brain and spinal cord. Always remember, if you're experiencing persistent pain, consult a healthcare professional for personalized assessment and treatment options.